Okay, let's talk about hiccups. You know, that universal thing that seems to strike at the worst possible moments, like right before a big presentation. Today, we're doing a deep dive into understanding and hopefully halting hiccups. We'll get into what they really are, why they happen, some simple things you can try at home, and importantly, when they might be signaling something a bit more serious.
Exactly. And it's interesting because while most of the time they're completely harmless, hiccups can sometimes be this surprising little clue, almost like a check engine light for your body, pointing towards underlying issues you might not expect.
A check engine light, I like that. So when you get that sudden hic, what's actually going on inside? It feels so abrupt, completely out of nowhere.
It really is involuntary. Basically, a hiccup is a sudden spasm, a contraction of your diaphragm, that big muscle under your lungs. And at the same time, the muscles between your ribs, the intercostals, they contract too. Then almost instantly, your vocal cords snap shut. That's what makes the hic sound. The whole thing is driven by what we call a reflex arc. Think of it like a nerve circuit involving the vagus nerve, the phrenic nerve, and some sympathetic nerves. It's all processed way down in the brainstem.
Yeah.
Any kind of irritation or disruption along that pathway can trigger it.
Right, that makes sense. So thinking about that circuit, what are the most common triggers? You know, for the kind of hiccups most of us get, the ones that just pop up and then disappear pretty quickly.
Yeah, the short-lived ones. Usually those are down to things that cause rapid stomach distension. So like you said, eating a really big meal, especially quickly. Or drinking fizzy drinks, maybe spicy food, sometimes alcohol.
Okay.
Even sudden changes in temperature, like drinking something very hot then very cold, can sometimes do it. And it's not just physical things. Emotional stress or getting really excited can also kind of perturb the input from that vagus nerve. Smoking is another trigger for some people. But the key thing is, these are generally, benign. They tend to sort themselves out.
Okay, so most are just annoying, not worrying. But here's where it gets, well, really interesting. What if they don't just go away? I've heard doctors use specific terms for hiccups that stick around, right?
We do. If hiccups last more than 48 hours, we call them persistent. And if they go on for longer than a month, that's termed intractable.
Wow, a whole month?
Yeah, and when they last that long, we start looking for other causes. Often they're linked to gastroesophageal problems, things like acid reflux, GERD, or maybe peptic ulcer disease, even an H. pylori infection in the stomach. Other possibilities include irritation, directly affecting those key nerves, the vagus or the phrenic nerve, or sometimes lesions or issues in the central nervous system, like in the brainstem or the upper spinal cord.
So, potentially more serious things then?
Potentially, yes. Less common, but definitely important causes can include certain types of stroke, especially ones affecting a specific part of the brainstem, like Wallenberg syndrome. Also, CNS infections or even tumors, metabolic problems like kidney issues or side effects from certain medications, steroids, or some chemotherapy drugs are known culprits. The main takeaway is if you have persistent hiccups, along with other clues, maybe new neurological symptoms, chest pain, things like that, that definitely warrants a proper medical checkup.
Okay, that's a really important distinction. But going back to the everyday kind, what can people actually do at home? Are any of the old wives' tales actually, backed by science?
Some of them have a basis in physiology, actually. The hiccup reflex is known to be sensitive to a couple of things: carbon dioxide levels in your blood and the tone of your vagus nerve. So strategies that increase CO2 can sometimes work. Things like breathing slowly and deeply, focusing on your diaphragm, or holding your breath for, say, 10 to 20 seconds, even breathing into cupped hands for a short time.
Right, like the paper bag trick, but maybe just hands is easier.
Exactly. And then there are things to stimulate the vagus nerve, which can help calm the reflex down. Sipping ice water, swallowing something granular like sugar or a bit of honey, gargling with cold water. Some people find gently stimulating the back of the throat helps, like with a cotton swab, but be careful.
Okay.
Even changing your posture might work, like leaning forward or pulling your knees up to your chest for a moment. It can compress the diaphragm. One thing I would caution against, though, is the whole scaring someone trick. It's unreliable and, honestly, you risk causing an injury if they jump or fall. Not worth it.
Good point. Definitely stick to the safer options. So we have home remedies for the common stuff. But when should someone absolutely stop trying home tricks and, call their doctor? What are the clear signs?
Okay, the thresholds are pretty clear. If your hiccups last more than 48 hours, 2 full days, you should get checked out. Also, if they're interfering with your sleep, eating, or breathing, or if they just keep coming back frequently, time for a doctor's visit.
And any emergency signs?
Yes, definitely. Seek immediate medical care, like go to the ER if the hiccups happen alongside any stroke-like symptoms. That means sudden numbness or weakness, especially on one side, trouble speaking or understanding, sudden dizziness or loss of balance, or a severe headache. Also, if hiccups come with chest pain, shortness of breath, or any new heart-related symptoms, that's an emergency too.
Okay, that's very clear. And if you do see a doctor, what do they typically do?
Well, the main focus is finding and treating the underlying cause, if there is one. If no clear cause is found, or, well, the cause is being treated, sometimes medications are used to help control the hiccups themselves, maybe something like baclofen or gabapentin, to modulate that reflex arc.
Right. So, wrapping this up then, the key takeaway seems to be most hiccups. Annoying, but basically harmless. You've got some safe, simple home strategies to try now, but definitely be aware of those red flags, hiccups lasting days, or coming with those serious symptoms.
Exactly. And it's quite fascinating, isn't it, how this very simple, very common reflex, a hic, can actually reflect such a huge range of things happening in the body. Everything from just drinking soda too fast, all the way to potentially a significant neurological event. It really does highlight how interconnected our bodily systems are, and maybe why it's wise to listen even to the seemingly small signals our bodies send us.